Welcome to TED Congress 2024 here in Scottsdale, Arizona. I have the distinct pleasure of having one of our top vascular surgeons here in the Valley. This is Avigayil Ribner, and she joined the Honor Health Vascular Group. It's 2 years now?
2.5.
Oh my God, time flies. So 3.5 years. She came from this place called New York, and she is a vascular surgeon. So, welcome here to TED Congress 2024.
Thank you.
What prompted you to do first surgery and second, vascular surgery as your specialty?
You know, I thought I was going to be an infectious disease doctor when I started medical school, and then I walked into an operating room, and that was it. My first case that I did as a medical student was a trauma on a 20-year-old who'd been shot in the leg, and it was a 12-hour bypass, and they let me sew part of it as a third-year medical student, and that was it. I was sold.
Did that patient live?
Yeah.
Oop.
Kept his leg.
Kept his leg too. So what drives you? Meaning, what exactly is your passion? The aorta, the carotid, limb salvage, or innovation and making new things happen?
I think my favorite fields of vascular surgery are carotid disease and limb salvage. I'm actually head of the limb salvage program here at Honor Health, and we've been recently revamping it completely to make it more comprehensive. We do a lot of innovative things within the field of limb salvage, everything from endovascular to open procedures, the full breadth of revascularization.
So let's get to maybe a sore topic. How do women fare as vascular surgeons in the vascular world?
There are a few of us. I would say in all the institutions where I have practiced, there's usually one, and that's the same now with Honor Health as well. Typically, I think that we fare very well. I think vascular surgery is a very flexible field where you can kind of make of it what you want. You can spend your entire life in the hospital. You can do more elective procedures if that's more your bag. And I think that's one of the things that drew me to it in general is that you can kind of pick and choose within the field.
I enjoyed your talk this morning.
Thank you.
It is not only about the disease of peripheral arterial disease, but also how you determine which patient needs what procedure and when to intervene. Mm-hmm. So do you think we are at a stage where we are picking up peripheral arterial disease early, treating it aggressively, or do you feel also that sometimes we are over-treating something?
I think the bigger issue is an education problem within the community. I think that primary care docs, family medicine docs, it's not on their radar to pick up on peripheral arterial disease. And so by the time we see it in our clinics, it's far advanced. And so part of what we've been doing also at Honor Health is education initiatives where we go out into the community and try to educate nurse practitioners, PAs, and the primary care community as to what would be a warning sign of peripheral arterial disease, and then getting these patients plugged in with the right people earlier.
Thank you, Dr. Ribner. It's been a pleasure to have you here in our Honor Health Vascular Group, and she's doing a great job in critical limb ischemia, awareness, detection of peripheral arterial disease. Congratulations, and welcome to TED 2024, and hope to see you again in 2025.